Welcome to Chapter 29. We're going to be going over respiratory care practitioners. So respiratory therapists, job opportunities should be very good. Hospitals will account for the vast majority of job openings, but a growing number of openings will arise in other settings. An associate's degree is the minimum educational requirement, but a bachelor's or master's degree may be important for advancement in management or education. All states except for Alaska require respiratory therapists to be licensed. Let's go over work description. Respiratory therapists are also known as respiratory care practitioners. They evaluate, treat, and care for patients with breathing or other cardiopulmonary disorders, assume primary responsibility for all respiratory care therapeutic treatments and diagnostic procedures, including supervision of respiratory therapy technicians. They provide complex therapy requiring considerable independent judgment. They interview patients, perform limited physical examinations, and conduct diagnostic tests, test breathing capacity and determine concentration of oxygen and other gases in the blood, measure blood pH, which indicates acidity or alkalinity, have patients breathe into a spirometer, which measures volume and flow of oxygen during inhalation and exhalation. So those are that funny kind of looking machine that you blow into, and it either has something that goes up and down. And so it is measuring how much oxygen you're taking and intaking. So use oxygen or oxygen mixtures, chest physiotherapy, and aerosol medications. They teach patients how to inhale aerosol properly to ensure effectiveness. Apply oxygen masks or nasal cannulus and set oxygen flow at the level prescribed by a physician. Connect patients who cannot breathe on their own to ventilators that deliver pressurized oxygen into the lungs. In some hospitals, therapists perform tasks outside their traditional role, involved in pulmonary rehabilitation, smoking cessation counseling, disease prevention, case management, and polysomnography, the diagnosis of breathing disorders during sleep, such as apnea. Respiratory therapists also treat critical care patients, either as part of surface and air transport teams or as part of rapid response teams in hospitals. Educational legal requirements to become a respiratory therapist. An associate's degree is the minimum educational requirement, but a bachelor's or master's degree may be important for advancement. All states except for Alaska require respiratory therapists to be licensed. Training is offered at the post-secondary level by colleges and universities, medical schools, vocational technical institutes, and the armed forces. So licensure and certification. A license is required to practice as a respiratory therapist, except in Alaska. The majority of states require completion of continuing education hours for license renewal. Most employers require respiratory therapists to maintain a cardiopulmonary resuscitation certification, so a CPR certification. The National Board of Respiratory Care offers the Certified Respiratory Therapist credential to those who graduate from entry-level or advanced programs accredited by the Commission on Accreditation of Allied Health Educational Programs, or the Committee on Accreditation for Respiratory Care, and who has also passed the CRT exam. The NBRC also awards the registered respiratory therapist to CRTs who have graduated from advanced programs and passed 2 separate exams. Supervisory positions and intensive care specialties usually require the RRT. NBRC credentialed practitioners become eligible to apply for specialty credential examinations for earning the RRT or CRT credential, so adult critical care, neonatal pediatric respiratory care, sleep disorder testing and therapeutic intervention, and then pulmonary functional technology. So job prospects. Job opportunities are expected to be very good, especially for those with a bachelor's degree and certification and those with cardiopulmonary care skills or experience working with infants. The vast majority of jobs opening will continue to be in hospitals. A growing number of openings are expected to be outside hospitals, especially in home health care services, offices of physicians or other health practitioners, consumer goods, rental firms, or the employment services, including as temporary workers in various settings. Take a look at this table, projection data for respiratory therapists from 2019 to 2029. So earnings, median annual wage of respiratory therapists were $62,000 in May 2020. The lowest 10% earned less than $45,000, and the highest 10% earned about $89,000. Let's go over respiratory therapy technicians. Job opportunities will be in decline because of changes in credentialing in the field of respiratory therapy. Completion of 1-year certification program is the minimum educational requirement. So work description for respiratory therapy technicians follows specific, well-defined respiratory care procedures under the direction of respiratory therapists and physicians. Help evaluate, treat, and care for patients with breathing or other cardiopulmonary disorders. Administer oxygen and breathing treatments to ensure patients are breathing properly. Prepare and test equipment before procedures begin. Analyze samples and maintain patient records. Respiratory therapy technicians typically work between 35 and 40 hours per week. Some healthcare facilities require patient care continuously, requiring technicians to work evenings and weekends. Direct patient care involves exposure to disease. Technicians can minimize risk by following proper hygiene protocols. May be required to stand and walk for long periods of time. Let's go over educational and legal requirements. A 1-year certification program is required to work as a respiratory therapy technician. Students who have completed the first year of an associate's degree program in respiratory therapy are sometimes designated as respiratory therapy technicians. So job prospects. Respiratory therapy technicians can expect keen competition. Very few openings for respiratory therapy technicians are expected as the work is increasingly performed by respiratory therapists. You noticed that when we went over respiratory therapists, that even though an associate's degree is the minimum education, having a bachelor's and master's degree is preferred. So that's where we are coming to where respiratory therapy technicians are not really used anymore because employers are wanting a higher education. Accredited entry-level respiratory therapy programs now require an associate's degree for the credential Certified Respiratory Therapist, CRT. Earnings is median annual wage for respiratory therapy technicians is $51,000. That was in May 2018. Here is a short video that we're going to go over about respiratory therapists.
My name is Anna K. Bowie. I'm a respiratory therapist. I've been a respiratory therapist for over 5 years. When I think of a respiratory therapist, me personally, I think about being someone's airway. We see life in the beginning when they come out and they take their first breath, even all the way up until the end stages of life. We also take care of that. No day is typical, but it's always important to be ready for anything.
I might need a backpack.
Alright, I'll break it down. We'll start out in the ICU. So that intensive care, you can have someone on the ventilator, you can have someone on a BiPAP machine, you can have someone on a high flow system. Each person needs something different. We'll leave that on for a few minutes, okay? And then I'll come back and take that off, okay? Alright.
This patient, she's been on the ventilator 8 days.
One of the reasons why I'm still here
is because of the people that work here.
I just feel like they're genuinely in love with what they do and they want to help. This is my favorite girl right here. Trust each other. We do.
Work, bounce back.
We do.
Each other. And I couldn't do what I do without her with these ventilators.
Yeah.
She's my go-to. She's my rock. I trust her. We love her.
I know. I love you. I love my coworkers. I really do. They're just special people. Individually, they're so strong. They have great personalities. They have great attitudes towards work and just the betterment of people. And when we're together, we're so dynamic. I would not choose a better team. If I have to work with them on a night shift, on the craziest night in a blizzard, I would choose them every time. Now we're going to enter the NICU. Let's see if we can find Rob. See what he's up to. This is our oscillator. Hi, Bob.
Hi, how are you?
Hi,
My name is Rob. I'm a respiratory therapist here.
I've been here approximately 15 years. About 5 years ago, our facility started taking smaller and smaller babies of micro preemies. We have an oscillator right here, which has the ability to deliver 600 breaths a minute. So it really does give a lot of little teeny
Tiny breaths for our micro preemies.
It's a pleasure working here. And
I feel like our opinions and our knowledge is very respected down here in the NICU.
My coworkers are just the bomb. They're just awesome.
And
no, you
can't have them. They're mine.
So that's very important to understand that, right? I like this stuff. I just always makes me think about back in the day. I know. Can you imagine me wearing like a hat like that? I would look dope with that thing. And Spirit gave me an opportunity for a job. In the height of COVID, I was looking to come back into the work field. That opportunity has been such a blessing because I got to meet all these new people, got to work with all these disciplines, and just really grew as a therapist. So that's like the beauty of it, and the people are so nice. So you can't help but to stay somewhere where you feel supported. And I do feel supported here, especially with my coworkers and with management. I just think they just create the environment where I feel like I'm safe and I really want to stay.
Okay, so that's it for respiratory therapists. We're going to go on to our next slides, which is going to be over clinical laboratory technologists. All right, so let's go over chapter 30, clinical laboratory personnel. So the laboratory team, a medical team of pathologists, technologists, and technicians work together to determine the presence, extent, or absence of disease and to provide data to evaluate the effectiveness of treatment. So this includes clinical laboratory technologists, clinical laboratory technicians, clinical laboratory scientists. Clinical laboratory technologists and technicians Clinical laboratory technologists usually have a bachelor's degree with a major in medical technology or in one of the life sciences. Clinical laboratory technicians generally need either an associate's degree or a certificate. Training programs for clinical laboratory personnel require both didactic classes and hands-on clinical experience in a laboratory. Most jobs will continue to be in hospitals, but employment will grow rapidly in other settings as well. Let's go over the work description. Clinical laboratory testing plays a crucial role in the detection, diagnosis, and treatment of disease. Medical and clinical laboratory technologists, also referred to as medical and clinical laboratory scientists, and medical and clinical laboratory technicians, perform most of these tests. Clinical laboratory personnel examine and analyze body fluids and cells, look for bacteria, parasites, and microorganisms, analyze chemical content of fluids, match blood type for transfusions, test for drug levels in blood that show how a patient is responding to treatment, type and cross-match blood samples for transfusions, and type tissue samples for kidney or other organ transplants. Prepare specimens for examination, count cells, look for abnormal blood cells and other abnormalities in body fluids, use microscope, cells, counters, and other sophisticated laboratory equipment, use automated equipment and computerized instruments capable of performing a number of tests simultaneously, analyze results, and relay to physicians. So this is pretty much a job that if you're wanting to work in the medical field, but you don't want to have a lot of contact with patients or other people, this is a good job for you. You work with your team, and that's pretty much it. You don't really talk to many other people. Continuing with work description, clinical laboratory technologists perform complex chemical, biological, hematological, immunologic, microscopic, and bacteriological tests. Technologists and technicians examine blood and other body fluids, make cultures of body fluid and tissue samples to determine the presence of bacteria, fungi, parasites, or other microorganisms. Scientists in large laboratories generally specialize in clinical chemistry, microbiology, immunology, cytology, or blood banking. Clinical chemistry specialists prepare specimens and analyze the chemical and hormonal content of body fluids. Microbiology specialists examine and identify bacteria and other microorganisms. Blood bank technologists, or hematology specialists and technologists, collect, type, and prepare blood and its component for transfusions. Immunology technologists or scientists examine elements of the human immune system and respond to foreign bodies, most commonly viruses and bacteria. Cytotechnologists prepare slides of body cells and examine them with a microscope for abnormalities that may signal the beginning of a cancerous growth. Molecular biology technologists perform complex protein and nucleic acid testing on cell samples for genetic testing of both inherent and infectious diseases. Pathologist assistants are physician assistants who work under the supervision of a physician who is a pathologist, preparing tissue samples for diagnostic tests and for autopsy. Medical laboratory technicians perform less complex tests and laboratory procedures compared to medical laboratory scientists. Technicians may prepare specimens and operate automated analyzers. So let's go over education and training. Requirements for an entry-level position as a clinical laboratory scientist is usually a bachelor's degree with a major in medical technology or life science. Universities and hospitals offer medical technology programs. The Clinical Laboratory Improvement Act requires personnel who perform highly complex tests to have at least an associate's degree. Medical and clinical laboratory technicians generally have either an associate's degree from a community or junior college or a certificate from a hospital, a vocational or technical school, or the armed forces. Let's go over licensure and certification. As of 2020, 11 states and Puerto Rico required licensure for laboratory personnel. Information on licensing is available from state departments of health or boards of occupational licensing. Many employers prefer applicants who are certified by a recognized professional association, so Board of Registry of the American Society for Clinical Pathology, American Medical Technologists, Board of Registry of the American Association of Bioanalysis. Let's go over job prospects. Job opportunities are expected to be excellent because the number of job openings is expected to continue to exceed the number of job seekers. An increase in the aging population will lead to a greater need to diagnose medical conditions such as cancer or type 2 diabetes through laboratory procedures. Prenatal testing for various types of genetic conditions is also increasingly common. This is something that I did with my baby. We got a genetic testing to make sure that there wasn't any problems. Medical laboratory technologists and technicians will be in demand to use and maintain the equipment needed for diagnosis and treatment. So take a look at the data for job prospects. This is from 2019 to 2029. All right, let's take a look at the earnings. Clinical laboratory technologists and technicians had a median annual salary of $54,000 in May 2020 and a median hourly wage of $26.05 an hour in May 2020. Based on a salary survey conducted in 2017, the average hourly wage was $22.38 for technicians and $30.49 for technologist scientists. The average yearly salary of technologists and scientists was about $15,000 higher than the salary for technicians. Average hourly wages are higher for laboratory workers with more education, training, and certification in specialties. So here's some data in the different areas, different places that technologists and technicians can work in, and there's also the hourly wage. So let's go over phlebotomists. Employment of phlebotomists is expected to grow faster than average and faster than other health professions. Phlebotomists require post-secondary training, including both classroom and clinical experience, to qualify for the certification exam. Most jobs for phlebotomists are in hospitals, diagnostic laboratories, and outpatient clinics. Some phlebotomists travel to different sites to draw blood. So hospitals, clinics, assisted living facilities, and nursing homes. Phlebotomists may specialize in population groups that require greater skill in drawing blood, for example, newborns or in the elderly. Competition from other health professionals who become certified as phlebotomists may reduce employment opportunities for phlebotomists. Let's go over work description. Phlebotomists draw blood for test, research, or blood donation. They explain procedures to patients and provide assistance if patients have adverse reactions after their blood is drawn. Some phlebotomists in blood donor centers may do simple lab procedures, using a centrifuge to spin a blood sample to separate red blood cells from plasma to determine hematocrit to determine if a donor has a normal amount of red blood cells before donating. Use both venipuncture and skin puncture to collect blood. Work environment. Hospitals, diagnostic laboratories, blood donor centers, and large outpatient clinics. Travel to patient rooms or to assisted living facilities or nursing homes to collect blood samples. So when I worked in the SNF facility, the patients would call these people the vampires because they usually came during the night or when they were sleeping to draw blood. May specialize in age groups that are more difficult to obtain blood samples because of small or collapsed veins, so infants, children, elderly. So let's look at education and training. Entry level is typically a post-secondary non-degree award from a phlebotomy program. Programs are available from community colleges, vocational schools, or technical schools. Usually take less than 1 year to complete and lead to a certificate or diploma. Some phlebotomists may enter the occupation with a high school diploma and are trained to be phlebotomists on the job. Beginning January 1, 2021, those applying to a training program will be required to submit official high school transcripts to verify high school graduation to be eligible for the training program. So certification, other qualifications. Employers prefer applicants certified by a recognized professional association. Certification typically includes education and experience requirements, successful completion of an examination, which may include demonstration of the ability to carry out both venipuncture and skin puncture. Laboratory experience must be in the CLIA regulated laboratory. Job prospects. Employment of phlebotomist is projected to grow 17% from 2019 to 2029, much faster than average for all occupations. Job prospects are best for phlebotomists who receive certification from one of several reputable organizations. So take a look at projection data for phlebotomists from 2019 to 2029. So earnings, the median annual wage for phlebotomist in 2020 was $17.46 an hour. The median annual salary for phlebotomist was $36,000. All right, take a look at this last video for this quarter.
Hey guys, what's up and welcome back to my channel. It's your girl Hillary, and today I am bringing you guys a career related video. For those of you who don't know, my name is Hillary and I am a board certified clinical microbiologist and a YouTuber. And some of you are like, what is that? In order to keep this video short, I actually have another video on my channel that I posted, and that got a lot of likes, interest, and views. So that is one why I'm doing another video. So in that previous video, I spoke about what exactly I do, what degree I got in college in order to be in this profession, the different career pathways that you can go with this degree. I also spoke about the classes I took, the boards, the certification exam, and all of that stuff. So if that is something you're interested in, definitely go check it out. And yeah. Moving on, so last one, I have the opportunity to plan, film, and create a career-related video in my lab for the United Way organization. In this video, we had to depict the work of a clinical lab scientist under 5 minutes, and because of the time limit, it was kind of difficult to show detail for detail the work that we do in the lab, but we made something shake. I'm so excited for you guys to see those videos, like fire shut up in my bones. Let me relax, but yeah, I am really excited for you guys to see those videos because I get to put my creative hobby into work, and also because I know that there's not a lot of light that's being shed in this part of healthcare because we're kind of behind the scenes of medicine. So yeah, I'm putting this video out there for people who have little or no resources concerning things like this, or just need help navigating the profession in general. So for whatever reason you're watching this video, that's why I'm putting it out there. So yeah, enjoy. My name is Paula Mister, and I'm a medical laboratory scientist and educator. Follow me as we see our technologists and what they do in the laboratory.
We are diagnostic detectives. We solve puzzles every day. Our work helps with at least 70% of medical diagnoses. Without our lab, doctors would not know what type of infections their patients have or how to treat them. We literally help thousands of patients every week. We set up and analyze all kinds of patient specimens to identify microorganisms such as bacteria, like staph and strep, viruses like the flu, hepatitis, and the coronavirus, parasites that can cause diarrhea, and fungi that can cause yeast infections in athlete's foot. Then we can do more tests to determine the best antimicrobial drugs for treatment. Our skills include performing and reading different types of stains, interpreting culture plates, and operating instruments like microscopes and complex molecular analyzers.
Working at the lab is very fast-paced. We work 24/7, 365. Whether it's operating the instruments or analyzing patient specimens, there's always something to do.
The favorite part of my job is working behind the scenes of medicine, yet still being an essential part of patient care. Medical laboratory scientists are the unsung heroes of medicine. Though we never get to see patients, we feel very connected to their care and treatment. Microbiology is a very challenging specialty, but we have so much experience here at Hopkins that we're always able to figure it out.
To work in a clinical microlab like ours, you can enroll in a 2-year associate's program for a medical laboratory technician or MLT degree, or a 4-year bachelor's degree program for a medical laboratory scientist degree, which qualifies you to perform more complex testing in the laboratory. There are several local programs in Maryland. We have a summary slide on the last slide of this presentation. Feel free to contact us. And thanks so much for watching.
So yeah, guys, that's pretty much it. The process of this video was super fun, from planning to creating to narrating to filming to editing. Like, I had so much fun with my team being a part of this. I hope you guys enjoyed it as well. Let me know if you have any questions down below in the comments, or you can DM me on Instagram. Honestly, I will respond. And yeah, you guys already know the drill. Make sure that you subscribe, like, comment, share, and all of that good stuff. And I will see you guys in my next video. Goodbye.
Well, that is it for Intro to Allied Health 101. Please look at Canvas for when your final is going to be. It should be in room 110. And I wish you guys good luck. And I enjoyed teaching you this quarter. Also, for the final, make sure that you do look at the test schedule to make sure that the times are correct. If you need to email me, please do that. I will definitely respond. Have a wonderful rest of your week.